Hey, well, thank you so much, everybody, for joining us. It is so good to see you. For those of you who I have not met, my name is Gio. I work on the partner management team at Citizen, and just really very excited to connect with so many different people across the country, maybe even world, to tell you a little bit more about the new Citizen AI Advocate. We have a army of people from Citizen here, so lots of folks across lots of different teams who are hopefully going to be able to provide some additional context and answer questions. But again, just very, very excited to have this chance to connect with you all. A couple of housekeeping items. There will be some surveys throughout the call. So if you see those surveys pop up, please respond. They are not required, but we always want to use these opportunities to get more information from you and kind of learn what you think about these different products and how you're interacting with us. So please keep an eye out for those. And then also you are able to ask questions, so you can raise your hand if you want, and we will pass you the mic, put you on center stage if you're one of the brave ones, or you can always just type questions into the chat if that is better. So let me see here. I'm going to see if I can get one of these polls going. Okay. Y'all seeing a poll that has popped up? Okay. Okay, we're winning. So take a look. Take a look. The first question is, which sources of information do you trust the most? So this is just kind of getting a general idea of where y'all get your information and where you like to get your information from. So go ahead. We'll let this roll for a second. And I'm going to continue on through the slide deck here. So to introduce us, again, my name is Gio. Fareed, is Fareed here yet?
Yep, I'm here.
Hey, Fareed, welcome. Thanks for joining us. Can you tell us a little bit about who you are, what you do at Citizen?
Well, not a whole lot, but no, it's a real pleasure to be here. My name's Fareed. I'm our CEO and one of our co-founders. And look, I've been working in the healthcare space about 10 years. We had a previous company that was focusing on the oncology space where I met Nasha, who many of you know, and is very much, frankly, my muse for the work that we do. And we started to work in the rare disease space a number of years ago and felt there was a massive opportunity, not just to help drive research, but to really be able to help every family and every individual navigate this very difficult journey better. And honestly, for us, the kind of heroes that we follow are the patient advocacy leaders and a lot of the fearless parents that kind of have blazed a trail for so many others behind them. And so we're excited that we're able to build tools and technologies and products and whatever else that we can do to support the community. And here at Citizen, I focus on our overall vision and strategy. I focus on the product, and I'm lucky to be surrounded by the best team I've ever had the pleasure of working with. So great to be here, and I'll pass it over to Gio to Devin.
Yes, Devin.
Great. Hi, everybody. I'm Deven McGraw. I'm the Chief Regulatory and Privacy Officer. Came to Citizen because at the time that I was working in the government in the HIPAA office, and we had published a bunch of guidance on the right of patients to get access to their health information. And I was super excited and thought, this is a great job. I get to try to change the world, put the power of data in patients' hands, and then um, Citizen gave me an opportunity to actually make it a reality for patients, and particularly patients with really complex medical conditions. And I couldn't think of a better place to actually do the kind of work that has really motivated me through most of my career, which is to give patients data and tools that they can use to make their lives better, to make their lives as easier as possible, and to facilitate research where they want to do it. So I'm super excited to be with you here today, and I will pass it to Kate.
I think we're
Or
gonna go
not.
over. Kate, do you want to hop in?
Hi, everyone. Great to meet
I should
you.
have
My
passed
name
it
is
back to
Kate
Gio. Sorry
Haldeman.
about that.
No worries, Devin. You're a tough one to follow, but I support community partnerships too, and really excited to learn from you all today and get your feedback on our wonderful new tool here. But Nasha, really want to pass it over to you to take us through the AI Advocate and how you use it in your day-to-day life.
Okay, perfect. All right, Jill, let's go to the next slide to
All
introduce
right.
myself. So, look, guys, I am the same as all of you. I'm a mom of a child with a really kind of devastating condition. So my daughter has a rare disease, Fox-G1 syndrome. She also has epilepsy. She also has autism. So dealing with all the fun stuff. And these pictures kind of say it all. Obviously, she's everything to me, but she takes everything out of us as well. And so the middle is my husband. We have to get on top of her physically to give her her seizure meds. The last picture is my son helping to put her shoes on. It isn't all of us on board, really trying to make it through a day with her. And so the daily life is a struggle, and I felt that I feel that every single day as a caregiver. I also started a research foundation, the Fox-G1 Research Foundation, to find a better treatment for this condition. Really excited that we are taking our first gene therapy into the clinic next year. And that process showed me more how difficult it is to get access to rich data that we need. I need it as a caregiver, I need it as an advocacy group leader, and I needed to develop a better treatment. And that's really what's driven me and my passion to work with this honestly incredible group of people here at Citizen Health. Next slide, Geo. All right, here's the team. Okay, so, honestly, sometimes I have to pinch myself that we have the opportunity, the team, to create something for us, for our families, because that doesn't often happen, right? We get looked upon quite a lot. And so here we just have a great team of engineers and designers and thinkers and lawyers, etc., coming together to make a difference in the lives of families like ours. Okay, so before I get into the demo, which is the real exciting one, I'm just going to explain how we do what we do to put this in context and what really makes us different and how we think we can help families like ours. So, number one is that all of our medical data is trapped in our medical institutions. We have access to MyChart, but MyChart doesn't actually have all of our medical data, and hospitals dispose of our data usually between 7 and 10 years. Also, most of us see multiple institutions, multiple doctors. If we move, etc., we change health plans, whatever it may be, our information is everywhere. So the first thing that Citizen does, thanks to Devin, we use our HIPAA right of access and we go and collect all of the medical records for families like ours. So what I mean by this is we don't have the burden of uploading our medical records. Citizen will go take your HIPAA right of access and collect all that medical data for you. Then it gets put in a secure portal that you own as a caregiver or a patient yourself. You could download that data, share that data really easily, post it on Facebook, whatever you want to do. It's your data, you own it. What we're here to do is help you actually make sense of that data. It's really hard to read thousands of medical records. So we have devised a way now using AI, and that's what I'll demo, of how you can actually get value from your medical records. And then something about Citizen that is really special is that you can choose, if you want, you have to consent to share your de-identified data with researchers. And those researchers are coming to our platform to accelerate treatments. And if there is any financial gain that comes of that, we actually revenue share that back with the patient community and back with any advocacy groups. And so it's a really special part of our platform and really goes into our name of Citizen Health. All right. So, one more slide before the demo. I'm just like so excited about this demo. Okay, so sorry, no, so Gio, go back. Let me go to our core principles. So this is really important, and look, security is really important, and privacy with our medical data. We are very different from just putting your records up on ChatGPT and getting answers. And Devin's going to really go through how we treat security and privacy. But these are the core principles we believe in. Patients own and control their own data. All data is secure and it's de-identified when shared, and it's only when a patient consents. And patients are compensated if data is shared for research. So these are the principles that we've really built the company around. The other principle is around patient burden. And so you'll notice as you go through our onboarding, it is very short. It's under 5 minutes. You basically log on. This is the home screen. You're gonna, you log on the way you want with your email address or with Google. And then we're going to ask you some very basic information, some basic demographic information, what your primary diagnosis is, and a list of providers. So we can then go and actually collect all your medical records. And then this is the consent if you choose to share your de-identified data with researchers. Okay, and so now what I'm going to do, thank you, I'll share screens now, is I'm actually going to show you my daughter's account. Okay, and let me know when you all see my screen. Or
Looks good.
somebody let me know. Okay, all right. Okay, so this is my home screen for my daughter Amara. And you'll notice on the left, I've got a dashboard, which is what I'm looking at now. I've got my medical records tab. And so as we go and we collect medical records, they're all going to fall in here. So my daughter is seen at a bunch of different places and all the records are here. I can easily now share those records. I can upload them if I want. I can ask for more. So everything is there. But what I want to show you today is our feature called AI Advocate. And that is really being able to talk to my medical records. So what I would like to do actually is I have done, I use this tool all the time, and I'd like to show you the ways that I personally use it. So here's something that I actually did today. So if any of you follow me on any of my social channels, you'll know that I'm having a really hard time right now with Amara's medications. And I had a call today with someone who's helping me find potentially a new neurologist for Amara. And they asked me, like, can you just give me a short description of Amara's condition? And sure, I could say it, but I'm not going to say it succinctly. I needed to grab everything. I went into AI Advocate, I asked this question, and it gave me a really short, concise description. I then wanted a little bit more information on her MRI findings. I asked, and again, and I'm just going to go down to the references here. So to give me this one paragraph description, it's going through all of my daughter's important, relevant medical records, her, genetic records, her other records, her MRI, etc. And so that's where it's pulling all this information from. And you can see, I said, can you please give me a sentence on her MRI findings in her frontal lobe? I don't really remember stuff. And, I'm like steeped in the space and I can't remember everything. And it's in a second gone through and given me her brain MRI, shows simplified frontal lobe gyri with reduced frontal white matter volume, et cetera, et cetera. And so it's all there at my fingertips. I was able to explain this to the person on the phone right away. Okay, that's a quick one. Another quick one. I was on another call, and someone just said, "What was her last EEG?" I did not remember. I'm sorry. I went and asked again, quickly pulls up my last EEG. Another way that I use this really quickly is when I'm in the emergency room, and we hear this from a lot of families. What do we get asked when we're in the emergency room? What are the medications your child is on? The last thing that you could think about when you're in the emergency room, your child is in a status, a status seizure. So now I can just go pull it up. This gives me my entire list of medications along with the dose, the route, the frequency, when it started. Again, all trapped in our medical records, all can be at our fingertips. So those are some quick ways that you can use AI Advocate to answer questions. Now, the other great thing is you get really comprehensive answers as well. So comprehensive diagnosis list. I needed this recently when I was filling out forms. We had to change her regional center when we moved. And so I needed all of her clinical diagnoses. And you can see that, our kids have a lot of diagnoses. FOXG1 is her genetic diagnoses, but she has tons of other diagnoses. And by the way, these diagnoses allow us to get more from our insurance companies. It allows us to get more therapies, but a lot of times we don't even know the names of everything that we could put down. So here it's broken it down by neurodevelopmental, neurologic, feeding, swallow, behavioral, et cetera, et cetera. So you can get a lot of very comprehensive. One of my favorites or least favorites is because it reminds me just how much my daughter at the age of 9 has gone through is a chronological timeline. And so this is going through her entire medical record. And again, all on my prompt is view a symptom timeline. And it's gone through from birth right? Every single thing that's happened to her that's been noted in her medical records. I was actually just talking to another parent before this call that started using Citizen. And the first thing she told me is there were three things that I learned from her timeline that I didn't even know that my daughter had. Like no one had bothered to even tell me. And now I know that she has these three other diagnoses. So it can go as broad as, as deep as you need it to go. Now, if you're going to share this with someone, this could be a bit overwhelming. And so, one of my favorite things that we have is explaining the diagnosis to a friend. And so, we've created this card that I've printed out and given it to all her teachers and everyone. And here's why I love this. So when you go to Google, you go to ChatGPT, you may say, give me a summary of Fox-G1 syndrome or whatever condition your child has. The truth is that all of our kids are unique. All patients are unique. One person's version of a disease is not another person's version. And what we have been able to do, and you can see here, is that yes, it gives me a little bit of introduction to Fox-G1 syndrome. But then it actually gives me Amara's version of Fox-G1 syndrome because there's a version of it where a child can be in a wheelchair, eating with a feeding tube, can't lift their head up. But that's not Amara. She's mobile, she can walk. Because of that, she has other issues. But that's her version of Fox-G1. And that's what this system has been able to do without me having to fill out a single survey or do anything. It tells me about the condition. How does it affect Amara's daily life? What is Amara as a person? Again, can you believe it? This is all in her medical record. In her medical record, it states that she's a warm, curious little girl because that's how I have described her to her doctors, and they write down what you say, and it's all trapped in these records. What are the important messages? A quick summary, things for teachers, for friends and family. So I printed this out and given it to absolutely everybody. And then this updates as things update about Amara. Okay, so just going through some of my favorite things and how I've used it. This is an area, insurance appeal, that we are having more and more families use, and families are able to now overturn insurance denial. So here's an example of me using it for Amara, where she's denied an adaptive bike. And you can see that this is one of our prompts, prepare for an insurance appeal. It's asking me for a bunch of information. I was quite lazy that day and I didn't really give it all the info. All I said was, look, it stated that weakness in muscle tone was not enough. It took just that and it's written me an entire letter that I could send out. And what I love about this, because this would have taken me an eternity to put together on my own, and I would have probably missed a few things. Actually, I would have missed a lot of things, or I would have had to hire a lawyer that's really expensive. It's literally gone through her medical records and given me her medical necessity rationale, right? It is this literally address the insurance company that this is not just about low tone, right? She has hypotonia plus ataxia. By the way, I always forget Amara has ataxia, impaired balance, poor trunk control, limited endurance, all of these things. It's brought up all of the facts to back my case without me doing anything. Again, as I don't know if I just said this, but we've had two families overturn their insurance denials with AI Advocate, something that we're really, really proud of. So hopefully this gives you some idea of the different ways you can use it. I'm going to go back to the dashboard real quick. And you can see many of the things that I went through. We have these prompts. So preparing for an insurance appeal, explaining the diagnosis to a friend, getting ready for an upcoming appointment is one that is used constantly. Before you go for an appointment, you may think you're prepared, but there are so many things that AI Advocate can help you make sure that you ask your doctor. One thing I would love to do, G, if you go back to the deck real quick.
Yes.
So that's what we've got today. Now, there is a new feature that we're launching, and this is just giving you an idea, right? Like our goal is and Freed always says this, like how do we make the tasks that families like ours go through easier? So one task that has come up quite a lot when we talk to families is the dreaded IEP, right? We have to go through this. We don't know what to ask. We're constantly arguing with our school districts. Depending on what type of district you live in, you may have to, appeal, etc. So we're creating something that is just for that, solving that problem, that pain point. Where here you'll notice, and it's in beta now, so that's why I'm showing you screenshots versus in the app. But it's basically, before the IEP, I got a draft from the school. Now, the draft is also like hundreds of pages long. I just uploaded it and I said, here's Amara's IEP. Can you please help me prepare a meeting I have for the school? And so now AI advocates come back with, all right, here's how I can help you. And it's given me some hot topics I can discuss. And then it's asked me, all right, what would be helpful? So I took this information and then I went back to say, like, okay, what's important for me? What are my main things I'm trying to get through with Amara? If you go to the next slide, Gio. So for me, as you can see on the top, I said I am most concerned with Amara having enough time with the correct having enough time and the most correct goals to improve her communication and daily living. Okay, my sentence doesn't even make any sense. But basically, I want to make sure she's getting enough communication therapy and I care about her daily living goals, right? So I said, can you send me the specific questions? And so that then it's broken it down for me within communication, the questions that I should ask within daily living, the questions that I should ask, and then some general things. And now I can continue chatting with this tool to get more and more information. But now I can go into my IEP meeting being prepared, having actual real questions to ask versus what I usually do, which is just overwhelming. There's 20 people in the meeting. We're just trying to get through it in an hour, and I'm not really sure if I'm even pushing for the right things. So just a few examples. Hopefully this gives you an idea of how this platform can really help you and your family.
Awesome. Thank you so much, Nasha, for walking through all of that. As we move on here, I'm gonna just do another poll here, and this is a simple one. Uh, this is just to ask if you've actually used the AI advocate or not. I think we have people across like all different citizen experiences here. We have people who probably aren't part of Citizen. We have people who are part of Citizen and haven't used the AI advocate, and people who are part of Citizen but have used the AI advocate. So give us a response here. And while that is running, Devin, I'm gonna pass the mic over to you.
All right, great. Thank you so much, Gio. I mean, I talked a little bit about my prior experience at working in the federal government in the HIPAA office, where we did a lot of work to issue policy and enforcement of the HIPAA rules. But before I had been in that role, I was the director of a nonprofit organization called the Health Privacy Project for 6 years and testified before Congress on privacy issues. So before I ever worked for a company and helped the company develop privacy protections, I actually was a privacy advocate and evaluated companies on how well they did privacy and recommended policy to try to get companies to do more than they were doing. And has always been one of my goals with Citizen Health to make sure that we had a product that I would want to use, that I would feel comfortable using, that I would feel comfortable having my mother use or my brother use or my nieces, my nephew, people that I care about, my coworkers, their children. Like, this data is very sensitive data, and we want to make sure that the environment is a secure one, that it's a private one, and that you are in control of this information. The other thing I'll add, one of the other things I do, which is a little bit less relevant to what we're talking about today with the AI advocate, but is definitely relevant to users of Citizen, is that I also am the person who helps make sure that the research that's conducted with Citizen de-identified data, using data from patients that have consented, is being done in accordance with federal human subjects research rules. And I bring to that work my experience of having served on what's called an institutional review board, which is a research ethics board for the federal All of Us Health Research Program. I'm still on that IRB. It's been a terrific experience. It has actually been incredibly helpful in shaping the way I help to guide our ethical research programs here at Citizen. Next slide, please. So first and foremost, these medical records that we collect for you, Nasha talked about it, the HIPAA right of access, those are yours. You own them and you control how they're used. You could basically come onto our platform, have us collect all your medical records and just sit and look at them all day if that's really something that is what you want to do. We try to give you opportunities to use them so that you can put your medical records to work for you, but that's really your choice. It's your choice to use the AI advocate. It's your choice to share your data. It's completely up to you. Those are in your control. And when you do say yes for research, that data is de-identified in accordance with HIPAA standards. Those are the only standards actually in the world where it's a US law, but it has global import because it actually has methodologies built into the regulations for how you're supposed to do de-identification. And we choose the hardest method. We choose a method that requires an expert to say that our data sets are de-identified in the hands of researchers. And this is particularly important because our communities are rare patients. And so already their data is by definition at slightly higher risk of re-identification because the patients have rare disorders. But that's why we use the expert determination to make sure that this research data is de-identified before it gets into the hands of researchers. And if we have an opportunity to put in front of you where what's needed for the research is identifiable data, we will ask you first. And you will have an opportunity to decide if that's something that you want to participate in. Again, our research is compliant with federal human subjects research rules. Research does not happen unless it's been approved by an IRB, either because the IRB has approved a specific protocol, or the IRB has determined that the data has been de-identified so thoroughly that it doesn't even qualify as human subjects research anymore. So, but we don't get to make that determination. The IRB tells us. This is an objective body. I'm not on our IRB, but we work with an outside IRB that handles all of our research approvals. Next slide, please. This is really important with respect to the AI advocate. Every day I get questions from people about whether they should use AI tools in their lives and what's going to happen to the data. And, there is this presumption that anything that's free and Citizen is free means that, oh, your data must be, is the product. And that's just not true for us. It was really important for us to get, in my opinion, it's not a meaningful choice if you have to agree to something in order to use the product or in order to use the product for free. Citizen is free whether you share your data or not. And the AI advocate, your conversations with the AI advocate stay within the Citizen community. We use a foundation model that helps our AI advocate learn quickly, provide the kind of advice to Nasha that can really help her with Amara's care and help her with IEPs, and it's going to help you too, we hope, if you use it. That foundation model is not allowed to use any data from Citizen Health conversations, the conversations you have with the AI advocate. They can't use it to train their models. They don't get access to it, to sell it, to use it. It's a foundation that helps us grow our AI and learn from our AI and teach the AI advocate to get better and even better at giving you advice based on your medical records, but it does not get shared with other people without your consent. And we would ask you specifically for that. That's not part of our general onboarding consent. We recognize that these can be very sensitive and private conversations that you are having with the AI advocate, and we don't share them unless you want us to, or you do so on your own. Again, not used to train third-party models. If you happen to use other AI tools, it is really important that you check those terms of service. Because we've worked really hard to create a tool that you can trust, and it's drawing information from your medical records, so it's even more important that it be a tool that you can trust. And we made sure that those conversations are going to stay within our ecosystem, subject to our privacy policy, not shared with third parties without your consent. So hopefully I've covered some good stuff. While I've been talking, I couldn't see any Q&A. I'll sort of hit that, and we can hit them during the question part of the session. But definitely wanted to make some what I thought were really key points for you about how we've designed this.
Thanks, Devin. I think it's really just important to know that these are questions that we get asked all the time, like especially with something new like this. Like you are not alone if you are asking these questions. You are in the majority.
Yeah.
And
You
we are
should be asking
lucky.
these questions.
You
You
should for
totally should be
sure.
asking these questions.
We are also lucky that we have Devin here as like a true expert in this space to be able to respond to these questions. And I think many of you have probably met her before if she's been able to attend, meetings with your advocacy groups. But yeah, I think she is a super valuable resource for us. And yes, thanks so much, Devin, for sharing your expertise. The questions are flowing in. This is awesome. We are kind of answering a few of them as we go, but I promise we will leave none of these unanswered. So we will get to all of them by the end, but please keep posting questions. This is excellent. Okay, so next we wanted not just for you guys to hear from all of us at Citizen, but we wanted to bring in a few members of the community, caregivers, or patients themselves who have actually used the AI advocate. So let's see here. Who am I? I'm gonna track you down here. Jordana, I see you on video. You're in the green room with us here. Can I have you come off mute and tell us a little bit about who you are and how you've used the AI advocate?
Yeah. So I am beyond grateful to share my experience with AI Advocate because we've recently used it in the emergency room. Um, Bjorn's journey to a diagnosis alone was 108 medical visits over 5 hospitals over the course of 8 months. That's not counting the emergency room visits. These are the ones that were pre-planned. So we found ourselves in the emergency room the other day with our son, and I'd just gotten back from a specialist visit in Houston. I'm driving 2 hours home in traffic, and I'm realizing my son is symptomatic, and it's getting worse since we've entered the car. I can keep my cool in terms of project planning, logistics, and strategy of getting him to the emergency room. But once we're checked in and a doctor starts spit firing questions, it's almost like I've exhausted my mom resources. That I used all of my free cards to survive the panic and to get my son there safely. I don't have the energy to go through 30 minutes of questions before you check out my son. So I literally took my phone. We are very familiar with our local hospital. We're frequent flyers there. And I said, you have my consent to ask AI Advocate whatever you need. All of my son's medical records are uploaded. Um, and it gave me time to comfort my son who was screaming and crying because he was in a scary hospital with fluorescent lights. A lot of sick people were in the waiting room. It gave my husband time to meet us at the hospital, and he's a molecular biophysicist, so he can digest the stuff in real time. And it saved me the horror of the car ride home going, oh my God, did I mix up 2022 with 2024? Did I say ASD instead of SPD? Did we discuss hypotonia because there's complications with breathing if they need to put him under, if there's a follow-up? I just got to be mommy. I got to hold my son and sing with him and let him know. The mommy and even the doctor will give you a kiss and your boo-boo will heal and it's going to be okay. And that was so special. That was a gift.
Thank you so much for sharing, Jordana. I think it's like experiences like these that make the work worth it. The late nights, the all of the hard work that we're putting into this to be able to see, that effort in action and like being helpful and useful. Yeah, that's I think kind of what it's all about. So thank you so much.
Yeah, thanks, Jordana. I think one of the things you said is so true that we just want to be moms, right? Like we just want to take care of our kids. And instead we're forced to be the doctor and the scientist and everything else. And I totally agree. It's one of the things I'm really excited about too, is that we could just get back to being moms. Thanks for sharing that story.
We've got a couple others lined up. So, Claire, I see you uh in the call here. I'm going to give you the microphone. Let me know if you're not free or if you're busy doing something else, but let's see how this works. Are you there, Claire?
Yes, can you hear me?
Yes, perfect. Thanks for joining us. Tell us a little bit about yourself and how you've been using the AI Advocate.
Yes. Hi, I'm doing well. I have a daughter with FOXP1 syndrome, and we have been using the AI Advocate the last few weeks, and it's been great. We used it for an immunology appointment actually a couple of weeks ago, and because we needed to provide a list of her prior illnesses since birth. So we asked the AI advocate to help with that. And it provided kind of a chart, a month by month breakdown of illnesses and rashes, ear infections, fevers that she has had since birth to just hand over to the doctor. It was amazing. And it was great because it just gave the doctor kind of an overview of everything that has been going on since birth. And she was able to just authorize some additional blood work that we had been looking to have done. So it was super helpful, super convenient for both us and the doctor.
Great. Thank you, Claire. I think some of these examples, I'm just always impressed at the way that you as caregivers take ideas that we maybe thought of behind closed doors with a little bit of perspective and a lot of bit of hope and like take them and make them your own and like really apply them directly to the ways that you can help your kiddos. So yeah, really, really cool. Thanks for sharing. Okay, and we have one more. Eric, I think you're in here. I'm going to pass you the mic too and let me know if you're still available. Can you hear us, Eric?
Yeah, can you hear me?
Yes, sir. Thanks for joining us.
Cool. Yeah, so I had a pretty unusual. So my child has a condition called Kleefstra syndrome, a rare genetic syndrome. And the way I've actually been using the advocate is to help me find my own internal records, which basically are in the form of photographs. So I think a lot of us, like anytime our kid is doing something unusual or something we want to show to the doctor, we take photographs or we take videos of that activity so we can show them later. And of course, that you may be showing that to the doctor, but it never gets to the medical record. And so I've run into cases where I wanted to go back in time and see what, he was doing when X happened or when Y happened. And so I've been asking the advocate, like, when was he hospitalized for this thing, or when did that thing happen? And then I can instantly find it because I can find the date that that happened, and then I can pull that right on so my photos archive, right? Probably like a lot of folks, is like just absolutely massive at this point because you have all the photos of the entire life you've taken, and all the other photos that you've taken, not just of your kid, right, but of everything. And so it's actually very tedious and hard to find what you want. But if you know the date, it's instantaneous. And so I found that really helpful if I want to look up like past behaviors or past events, and have the photographic and video records. I can just pull those out really quickly from my own photo archive. So it kind of lets that photo archive be an augment to the medical record and medical history.
Yeah, Eric had shared that story with me earlier this week, and I was just like kind of blown away. Like the most out of the box thinking, like triangulating medical records with photos, and it just felt like such a good example of that was not on any of our bingo cards. Like we did not think anybody was going to use the AI advocate for that exact purpose, but still just a really, really unique way, yeah, to take advantage of that. So thank you so much for sharing as well. Okay. So I have we're going to move through these a little bit quickly because we've spent a lot of time here, but I think, very frequently we're hearing from people who are using the AI advocate every day. And it's simple things. I think many people are so familiar with having this binder full of records, this, 1,000-page long history, and just being able to take something that is that chaotic and provide some very specific answers in a quick period of time. Um, We've had some very creative examples of people using this, like Nasha had mentioned, to help with IEPs or to help with insurance appeals. Um, we've had some sorry, here we've had some other examples of just taking these very long questionnaires where you're asked a million things about health history, and there's just no way that you could remember all of those. Even if you have the records, it's hard to go through and find all of those. But with this, it allows you to kind of pick those needles out of a haystack over and over. Um, and then, kind of lastly, we see again people who are looking at thousands of pages of medical records, being able to ask questions and get answers really quickly, being helpful in so many different ways. Fareed.
I just wanted to make one quick comment that look, one of the other things that we're really, really keen to hear from the community, um, as Nasha showed in that early picture, we have a big team that is really dedicated to making this the best experience possible. But we're in early days at the same time, and so we get really, really excited and fired up when we get a lot of these unsolicited testimonials from our patients in terms of and our users how they're using it. But we also know that there's areas that we can improve. We know that there's better features we can build. There may be challenges that you're facing that we haven't thought of and we haven't addressed yet. So for those that are using it, for those that would use it, we also, strongly encourage you reaching out with feedback, whether it's constructive, whether we've gotten something wrong or something needs to work better. And we actually have a feature right inside the app itself, where on the bottom right you can, click. You'll see a little button you can click where you can talk to someone directly on our team. That's typically Mikkel, who leads patient support for us. Or you can always reach out to any of us individually or provide feedback to support at citizen.health. But just want to say we love to get that constructive feedback back as well.
And at the very end here, I do have our support email address included, so we'll make sure y'all know how to get in touch with us. I'm going to launch another poll here. So this one is a little more specific about kind of looking at the different ways that we've seen people use it commonly and just trying to get a little perspective on if any of these things resonate with you or if you think they would be useful or helpful moving forward. Okay. So we are technically at the end of the content piece of this. We want to make sure that we'll get a chance to go through all of these questions, but also wanted to make sure that no matter where you are on kind of the citizen spectrum, that you get a chance to learn more. So the website here, citizen.health /unlock. That's a way if you want to sign up for Citizen and learn more about it, you can go there. A QR code will get you to the same place. And then also wanted to highlight that we are currently in the midst of the Share for Rare campaign, our fall campaign, where we're really trying to get people more into the AI advocates and give them chances to actually use it to walk around to see what works and to give us feedback. And as part of that, we have a $5,000 giveaway for people who are able to participate and use the AI advocate. So if you haven't or you've been waiting to, now is a great time to get started on that. Okay. And for questions, Fareed, this was your foreshadowing here, but if you do have questions, support at citizen.health is the best way to get in touch with all of us. Mikkel is the person who will mostly be responding here, but she is also good at forwarding these messages to the right folks as well if you need to touch base with one of us specifically.
And Gio, there was a question in the chat, which I was trying to answer in the chat, and I hit the wrong button. I think we can maybe hit that one first. But there was one question on, I think it was a comment around, thank you for making accessibility available. Can't wait to share about this with other language communities. So there was a question earlier as well on international use in multiple languages. So when you sign up for the application, the entire sign up process is available in, I believe, 7 different languages. I listed them in the chat, and I may miss them at the top of my head, but I think it's English, German, Spanish, French, Turkish, Chinese, and I might be missing a Mandarin, and I might be missing one.
Danish.
Sorry.
We also support Danish for the
Okay,
2 million
got it.
Danes.
Okay, and Danish. The actual AI advocate, so what you saw Nasha demoing where she's, talking to it, you can talk to it in any language. You can ask for it to speak back to you in any language or respond in any language. It also has the ability, if you have medical records, let's say in English, but you're talking to it in Spanish, it has the ability to work with that as well. Um, the one limitation we do have for international users is currently we do not have the ability to collect medical records on their behalf, but they do have the ability to upload their own medical records, and then the AI advocate works on those just as it does, like Nasha was showing. So I know there was all of that wasn't in that question, but we get the question around international and multiple languages, so I wanted to make sure we address that.
Excellent. Thank you, Fareed. I'm going to go kind of through these questions a little bit, but feel free to add more or raise hands if anybody wants to hop on mic. But Lisa, you had asked the question if this would be useful for children who pass away. Definitely. As Devin had mentioned, parents still have the right to request those medical records. So can still use the AI advocate to ask questions or to inquire about the medical records. Um, Also, Lisa asking a question about medical records having errors. So this is interesting because we do see this from time to time in the medical records. There can be errors or omissions. And one great thing about the AI advocate is that when it gives us answers, it tells us where those answers are coming from. So we have the ability to go back and double check and see what that looks like. And in some cases, it could be that there are errors there, and that's a good thing to be able to surface as well.
Yeah, the other thing that occurs to me, Gio, that I really just thought of is because we collect records from, all the patient's medical providers, the presence of an error in one medical record doesn't necessarily mean it's wrong in another medical record.
Hmm.
That is something that that we can catch when, particularly if you're one of our users who has consented to research, there will be a process where your data will be abstracted and we're able to kind of reconcile some of those discrepancies, at least with respect to the data that gets shared with researchers. So
Yep.
we can't make changes to your medical records. That would be problematic for our ability for the patients who say yes to research, for us to be able to say that our data is true to what came out of the medical record, right or wrong. But we certainly can do do our best to reconcile discrepancies across, again, multiple providers. There's usually duplicate information, and it helps when you have all those records as opposed to relying just on the one that might have some errors in it.
As someone who has spent a lot of time in those medical records previously, I could say that maybe not just duplicates, but triplicates and quadruplicates and
Quadruplicates,
as
quintuplicates.
many times X as you can imagine. Okay, Jedri asked a question about what was this? Oh, engaging with other partners. And Fareed, thank you for providing that contact information. I think that's a really important piece of this for us too, is that we want to be collaborators. We want to work together. The adage of tides raise all boats. Like I think that very much applies to us. So yes, very much interested. Elizabeth, if we share medical records directly to a provider for research, is it de-identified even if we share it directly? Um, Let's see, Devin, you had replied to this one,
I
right?
did, but I think I misunderstood the question. So I was actually thinking of it in the context of, oh, are all outside of Citizen Health, if you happen to share some records with a medical provider, would those be de-identified? When we prepare a research data set, we de-identify that data. We make sure that it meets our expert determination. If you were to share your citizen profile with your medical records in it with your medical provider, that data wouldn't be de-identified. There's a functionality in the Citizen Health platform that allows you to essentially share those records with anybody that you want, the raw underlying medical records. Those won't be de-identified. But when we have research that we are engaging with a partner, whether it's a commercial partner, an academic partner, or one of the patient advocacy groups that is conducting that research, or the research is being done with a key opinion leader that the patient advocacy group has a relationship with, like that data is going to be de-identified, but your individual sharing through your profile would not be. I may have misunderstood that question when I answered it. So hopefully it's clear now.
Yes, I think
Ask
so.
another question if it's not.
Thank you, Devin. I'm seeing more questions. Lisa, yes. Um, if you, yeah, we are always interested in connecting with new groups and new diseases. So definitely reach out. We would love to chat more about ways we can support. Let's see. An open question. Devin, do you see this question in the open section from Jedri?
That's a repeat of the one
Okay.
that Farida.
Oh, yes,
Yeah.
you're right. Yes.
Yeah.
Okay, thank you, thank you. Lots of thank yous. Okay. I think
I do have one, Devin, I was on a call earlier today with someone really asking, how we think about our privacy and security versus ChatGPT or just like open, not training our models with the data. I don't know if you or Fareed could talk to that in any way.
Yeah, I mean, it's the issue that I raised, but I think it's sometimes hard for people to understand. Our AI tools are generated in-house, but we do leverage what's called a foundation model to help speed up our process of our AI learning from your medical records, providing the proper feedback back to people's questions. And because we're using that's a an available tool, we're relying on it, but we deliberately chose a tool that does not leverage the data from our chat GPT, from our AI advocate questions. So any conversation, I hope I'm making sense. This is kind of hard, I think, for people to understand. So I'm trying to explain it in a way that makes sense. But
Devin, I can take a shot
yeah,
if
okay.
so if you've used ChatGPT or any of these common models, when you and I go to ChatGPT and we're having a conversation, and I'm not at all, by the way, suggesting anything nefarious here, but the way these models get better is OpenAI, which is a company that has developed ChatGPT, just using that as an example, which is obviously a very powerful tool. All of the conversations we have with it is accessible to to the people at the company in order to make those models better. And so one of the things that we have made sure to do is even though we will leverage some of the technologies other companies have built to allow us to move a lot faster on developing the AI advocate, we have made sure that we have provisions and protections in place that none of those third parties ever get access to your data to be able to train on it, to be able to look at it, to be able to do any such thing with it. Um, uh, and so that is one big distinction, because again, not at all suggesting anything nefarious per se, but obviously our health information is incredibly sensitive, and so that's something that we've made sure to take a lot of extra steps around. And the only thing that um, you are committing to when you sign up to the platform is if the AI advocate isn't working well, it has a bug, our team needs to go fix that bug, and we have the ability to go do things that will allow us to improve the product and improve the experience. But nothing is ever shared with a third party. Um, and that goes actually with all the de-identified data and things like that as well. All of that is always dependent on your consent. So there was a question in there about our business model. You can sign up for this, never pay a dime because we don't charge patients. And you can choose, I never want to share my data with anyone. We end up seeing a very high percent that do end up sharing. And when it is shared, it's de-identified. But just to triple clarify that as well, it's not sort of a, if you want to use it, you have to share your data. It's an option that you always have, including with your providers.
So there's another question I see from Amanda about technology protections for protecting the data. So we use a HIPAA compliant cloud service provider for storage of that data. They are not allowed to access that data. It is end-to-end encrypted, encrypted at rest, encrypted in motion. We have a SOC 2 Type 1 certification. and we expect to get our SOC 2 Type 2 certification in the first quarter of 2026. Which means a third party went through our security protections, kicked the tires, and gave us a thumbs up that we were doing well, and we'll get there'll be a reassessment of all of that, and we'll get a second one in March. So I feel really good about the security protections we have. We train our staff. We go through phishing exercises. We actually send phishing emails to the staff, and they have to figure out, though, this is probably something that I shouldn't click on. And if they click on the wrong thing as a test email, they have to go through phishing training again. So we put our workforce through the most robust security that we possibly can, because we recognize that this data is very sensitive to you, and we want to protect it. I hope that helped.
Yes, definitely, Devin. I did also just put up a poll here. I think it's still going. It's more of a call to action. If there are people still on the call who are interested in helping us and getting involved in kind of early access to some of these things as we're building and creating, please share your contact information, or you can reach out to us after the fact as well. But we would love to again get all of your feedback and make sure that we're continuing to build things that we think are helpful and that you'll be using. I also see a question about available to any patient in the US, both insured and uninsured. And Devin is typing, but yes, yes.
No, I was typing. I was like, well, certainly insurance status doesn't matter. Like we're mostly serving patients with rare disorders now, but you can be insured, uninsured, partially insured. That's not a factor.
Okay. Going once, going twice. Any other questions? All right. Thank you so much. First to all the citizen folks here. I know this is not always easy to get people together late like this, but it is so great to have you all here. And to all of the patients, caregivers, everyone attending. We are grateful for your partnerships. We are grateful to be on this journey with you. Thank you so much for taking time out of your day to hang out with us. If there's anything else we can do, if you have more questions, please reach out. And I hope y'all have a great rest of your evenings.
Thank you.
Thanks, everyone.
Bye, everybody.